I think that the field of hematology in general is moving so fast that it really is hard to keep up with so many of the advancements. And you could think about the new drugs and the new approaches, multiple phase 3 trials in myeloma. You could talk about the better treatment for patients with relapsed large cell lymphoma. You could talk about things like, are we ready for no chemotherapy at all and combination therapy for CLL? I think CML is already well ahead of us in terms of making life better and simpler for patients across the board. But are there monitoring tricks that we can learn about? Finally, in the myeloproliferative disorders, everything changes every 6 months. And so not only the testing, but the treatment of patients with MPNs is moving so fast that this is really the ideal time for the Winter Conference to really be in place. I think one of the biggest gaps we struggle with is that, again, things are moving so fast that what was standard of care 6 months ago in any given disease may not be standard of care anymore. And making those paradigm shifts in routine practice doesn't just happen overnight. You need to hear about it multiple times, and you need to have the ability to see the data to help inform your practice, and that's what this meeting does so well. Multidisciplinary care is sort of the buzzword in oncology right now, but the reason it's the buzzword is because when we know that different specialties come together, you get better outcomes for patients. And I think what this meeting does is highlight the importance of that team, and it brings together many members of those teams together to present information to oncologists across the country. Well, I think there are a number of phase 3 trials that are coming out that are really, really exciting and important. We know, again, in myeloma that there are at least 3 randomized phase 3 trials that will likely be reported or are being reported now. We know the same exists for lymphoma and CLL. I think getting to an idea of combining BTK inhibitors with BCL2 inhibitors in CLL, I think is really a cool idea, and that will change the paradigm of CLL. When we think about other diseases, again, like MPNs with multiple emerging agents, and acute leukemia, which has been a fairly dead field for a long time, there are multiple drugs now that are coming out that I think are really making a difference. Smoldering myeloma is about to undergo a pretty rapid change. There will be a publication coming out from the ECOG trial, which I think will cement the idea of early therapy. So knowing how to risk stratify patients to determine treatment is really going to be critical going forward. A lot of times as an expert is on stage, we sit up there and sort of pontificate, but we don't often hear the real-world patient experiences from our community colleagues that are dealing with these patients as well, and sometimes some of the sicker patients. So that interplay between community provider and expert on stage is really key to figuring out what the best middle ground is when we're talking about taking care of patients. What's really unique about this meeting in many different ways is that it's packed with lots of information from some of the best speakers and opinion leaders in their field in the world. We have people fighting over who gets to give what talk at this meeting. And that competition is a good thing because it means as the viewer, you get the best of the best. And that's what makes this meeting so special.